This segment of DelmarvaLife is brought to you by Peninsula Regional Medical Center.
They are one of the most commonly performed tests in the U.S., EKGs, but one group is now saying they may be overperformed. According to the American College of Physicians, you don't really need an EKG if you are asymptomatic and low risk for heart disease. They add that while the tests are safe, they are expensive and say there is no real value to using them. As for other tests, the American College of Physicians is encouraging doctors to focus on risk factors before deciding on those.
So what are the other tests? Well, another popular one is the stress test. According to the National Institute of Health, more than 10 million stress tests are performed each year. It's primarily used as a non-invasive way to detect heart problems by using exercise, and most times they're used on patients with suspected coronary artery disease.
Well, here to tell us more about the test's necessity and alternatives is Dr. Joseph Cinderella, Medical Director of the Cardiac Cath Labs at PRMC. Welcome, Dr. Cinderella, to the show.
Oh.
Now, I just mentioned the recent recommendation not to have EKGs performed in certain situations. What's your take on that?
Well, I think you're referring, there was an article published about a week ago in the Annals of Internal Medicine that went over that, and basically it's really focusing on low-risk asymptomatic patients. Really shouldn't be getting a yearly EKG as part of their routine screening. It doesn't address patients with suspected cardiac disease or particularly patients with symptoms. That's a different story.
And they should.
And those patients should be screened with EKGs and so forth. But the low-risk asymptomatic patient doesn't really add much.
Okay, so what does an EKG show you?
Well, an EKG is an electrical, very simple electrical test looking at the heart's conduction. You can detect whether they've had a prior heart attack by it. You can look at their heart rhythm. You can see if they're in a normal rhythm or atrial fibrillation. Yeah. You do get potentially a lot of information from the EKG, but again, for low risk and asymptomatic patients, it's not doesn't really add a lot.
Another test is a stress test. What's involved in that?
That's a good question. There's many different ways we can do a stress test. In its simplest form, the patient's just hooked up to an EKG machine, walks on a treadmill at increasing levels of activity, and we just monitor their EKG as they're exercising. That's just a conventional stress test. There's many other types of stress tests that might involve nuclear agents, might involve chemical stress testing, and there's many other ways we can assess the heart as well, but a regular stress test, just an EKG while you're on the treadmill.
So are there times that a stress test is necessary?
Yeah, for sure. I mean, patients with suspected coronary disease, when the risk is determined to be in the intermediate range where you're trying to make a decision whether to be more aggressive or less aggressive or invasive versus non-invasive, that's when it really is a good test. Where it doesn't seem to add much, and again, this is going to this article you spoke about, is patients that are low risk or asymptomatic. A stress test doesn't add a whole lot. If there's something we use in cardiology, whether consciously or subconsciously, called Bayes' theorem, pre-test probability of disease.
Okay.
A 25-year-old patient with minimal symptoms and no risk factors may have a pre-test probability of 1 in 10,000. Even with a positive stress test, you might raise that probability to maybe 2 in 10,000. Doesn't really help you much. Likewise, a patient who's 65 with every risk factor there is and classic symptoms, their pre-test probability might be 95%. And a positive result might raise it to 98, and a negative might lower it to 90, doesn't add much. Where the money is where patients with intermediate risk. Patient with a couple of risk factors and a decent story for coronary disease, their pretest probability is in the 30 to maybe 70% range.
Right.
That's where it makes a difference.
So what are the signs that we need to look for?
Symptoms of coronary disease typically would be chest pain or pressure with physical activity. That's one of the reasons we put patients on a stress test. Other patients may have shortness of breath with activity, might have a heavy feeling. There's lots of different ways it may manifest, but the most common textbook type symptom is chest pain or pressure with physical activity.
Okay, now there are changes in our lifestyle that we can make to avoid all this, right?
Oh yeah. There's a lot of decisions that we make every day that may avoid getting to this situation in the first place. Smoking is probably one of the big ones that avoiding smoking will buy you some time for sure.
Yeah.
Avoiding fatty foods, watching your cholesterol intake, watching your diet, losing weight, physical activity, those are all things that are going to help you in the long run.
All right, so preventative measures are the best measures we want to take.
Sure.
All right, thank you,
so
Dr.
much.
Cinderella. And if you would like more information on heart-related issues or on the Guerreri Heart Institute at PRMC, just go to WBOC.com and click on our picture at the top of the page.
From help with stress and health to help making your prom dreams come true. Sean?
Jimmy, when I went to prom, I got to rent a tux. Meanwhile, my date was left spending hundreds of dollars on a prom dress. But for some girls, spending that kind of money just isn't an option. Up next, we'll show you an organization that's having girls look great without breaking the bank.
And prom night is one big photo op, so are you ready? Next, we tell you just how to get a professional-looking photo on your smartphone. DelmarvaLife, we'll be right back.